Okay, Bismillah ar-Rahman ar-Rahim. First case will be communication skills with Dr. Sana. Mrs. Hala is 27 years old. She has been complaining of weight loss and recurrent vomiting for the last 1 month. Blood investigation done for her and short selectin test, and she is confirmed to have Addison disease. You are senior officer of the medical department, and your role is to explain to Mrs. Hala her disease and any concerns she has. Dr. Sana, you have 2 minutes to prepare yourself. Dr. Mushabir, he sent me a message now that he is driving and he cannot share. So, first case will be by Dr. Sana. Second case by Dr. Yahya. Third case by Dr. May. Dr. Wael Said and Dr. Yasser, we hope to cheer us soon.
اوكي شوف بقى الناس بقى دكتور صادق قول لنا واحنا نشير.
دكتور وائل
ايوه معاك اهو.
ماشي يا فندم، يا ريت يعني if you want next time it's okay يعني.
اوكي خلاص ان شاء الله. اوكي.
Okay, we can start it, Miss Dr. Saad.
Okay.
Yes. Yes, hello, I'm Dr. Fadlallah. I'm doctor in the Gynecological Clinic. You are Mrs. Hala, 27 years old.
Yes, doctor.
Nice to meet you, Mrs. Hala.
Nice to meet you, doctor.
Yes, Mrs. Hala, today we are here to discuss about your house problem and that you did before. Is that okay with you?
Yes.
Okay, Mrs. Hala, first, can I do it?
What, doctor? Again, doctor?
What do you know about your illness?
Doctor, I have been complaining of weight loss and recurrent getting sick. For the last 1 month, I seek medical care and I was admitted.
Okay, Mrs. Hala, ask you what you know about your...
And I was admitted for the last 2 days because of that, and I'm coming to know the result. The result of my blood test, doctor.
Yes, Mrs. Hala. So, Mrs. Hala, what's your expectations about the result?
I'm not sure. I don't have a specific expectation, doctor.
Yes. Okay, Mrs. Hala, as you have been complaining of this weight loss and this recurrent sick, and the last test was done for you, and that was showing you have some problems which is called Addison. Do you have any idea about this?
No, doctor. Is it serious condition, doctor?
Okay, Mrs. Hala, sorry to tell you, this is a disease. It can be treated and treated well, but if not treated, yeah, it will be serious. But if we'll treat it properly, so it will be serious. Just Mrs. Hala, can I will tell you more about this disease?
Yes, please, doctor.
Yes, Mrs. Hala, this is a disease. It's a cause by effect of some gland in the body. This is a gland which are secreted in the body called steroids. And this is a steroid is responsible for many things in the body. One of them is responsible like for the blood pressure, is responsible for also the well-being. So for many there is many reasons this gland sometimes it will not function properly. Most the common cause for that is sometimes the immune system. They will disturb and they will react against this routine. This is the gland. The product of this is a gland. So they will not produce enough amount of this cortisone in the body. So they will making for you all the symptoms what you have, this weight loss and vomiting. Okay, and this is Mr. Hala. This is the gland which was affected. It is a small gland. It is lying above every kidney. Okay, and this is a gland. It is here in your condition. This is a gland which cannot be secreted. This is cortisol. So for that you have been these symptoms. Are you following me, Mrs. Hala?
Yes, doctor. There is no treatment for this disease, doctor?
Yes. No, Mrs. Hala, there is available treatment for this disease. Okay. This disease is most likely how we treat it. We will treat it by replacement, which this cortisone it was be deficient. Meaning because there is the gland, it cannot produce enough amount of this proteins, steroid or cortisone. So when we replace it, so your symptoms it will be improving. So this will need to be multidisciplinary teams, which are include the gland doctor. Gland doctors, he will start it for you. This is which called steroids, and so you need to take this steroid tabs and to your symptoms, and you will be feeling well after you started to take the treatment. In most of the case, we need to replace it of this steroid. Hello?
Yes, doctor.
Okay, in your cases, we need to replace this steroid because this deficient in the steroid, it will affect it, even the electrolyte. I don't know what is electrolyte. Okay, it will affect it, the minerals also in the body. The mineral, yes, it will affect the minerals in the body, and so this is disturbing the minerals. Also, will contribute to your symptoms also. By taking this steroid tabs, so you will feeling well. But as you know, you need to be taking this steroid regularly as prescribed by the doctor. And other thing is important because other thing, you need to be your doctors and everyone they knows you have been taking steroid. So you will use of the what's called of the medical bracelets in which you are writing your dose of the steroid, because situations like an infections or like any stress condition, sometimes you need to be replacing of steroid. Are you following me, Mrs. Hala?
Yes, doctor.
Yes, Mrs. Hala. Okay, Mrs. Hala, can I ask you some question?
Yes, doctor.
Okay, Mrs. Hala, what you are doing in your living?
I'm a secretary, doctor.
Yes, Mrs. Hala. Did you smoke?
No.
Okay, did you drink alcohol?
No.
Okay, Mrs. Hala, with whom you are living?
I'm living with my husband and my kid, doctor.
Okay, Mrs. Hala, are you supported well financially?
My husband is helpful, doctor. He's supporting me.
Yes, it's okay, Mrs. Hala. Okay, Mrs. Hala, as I told you, you will have been follow with the multidisciplinary team, include your gland doctors and also your GB doctors, and also the one, it's important one in the team. You should be you will tell of the doctors to how you receive steroid and how you will replacement of the dose in and like okay, that's okay with you, Mrs. Hala?
Yes, doctor.
Okay, Mrs. Hala, can I know what's your concern?
Regarding these steroids, doctor, I know that steroids has a lot of complications in the long run. For how long I'm going to take these medications, doctor?
Yes.
Steroids, doctor.
Yes. Okay, Mrs. Hala. And like your situations, as you have been, the body, it is not, or the gland in your body, it is not produce enough amount of this, or it is not produce steroid. So you will be replaced for life. Mostly, you need to be replaced for life, Mrs. Hala.
What about complications
So,
with
and
steroids,
regarding
doctor, in the
this
long
steroid
run?
in your okay, Mrs. Hala, because about your condition, because you have been a defect, so you will be received dose of the steroid, as it is not causing for you the symptoms, and also the same thing, it will be less complications. Less low dose and less complication to reduce of the steroid complication, Mrs. Hala. So it is less likely to get complication from this dose of steroids.
But I'm going to take these steroids for a long time, for all over my life, doctor. I think it will cause these complications.
Okay, Mrs. Hala, because this is amount of steroid you will be taking, it will not be high enough to cause for you this complication.
Yes, doctor.
But only it will replace the steroids which are not producing by your gland. So don't worry about that, and you will be under strict follow-up by the doctors, and they will know if there is any complications it will happen. But it's most likely the dose of steroid which you will take in, it will not causing for you a serious complications like that.
Can I get
Unless you have been taking dose is more than what. Yes, there is no problem in that, Mrs. Hala, but you will be, if you are going to be get pregnant, you will be in the, you should be planned and you should be in the follow-up with your doctor, your this obs and gynae doctor, and your grand doctor. So for this period, so you should be follow-up with them. Okay.
Yes, doctor.
Okay, Ms. Hala, so do you have any other concern?
No, doctor, thank you.
Okay, thank you, Ms. Hala. So, Mrs. Hala, let me summarize for you. You have been complaining of weight loss and recurrent vomiting for the last 2 months, and lab test was done for you, and they discovered you have been Addisonian disease, which is a disease caused by the defect into the glands, and so for that we can be, it will be managed with the multidisciplinary team, include the gland doctor. So you need to be replaced by steroid for your life, and also you will be use of the medical bracelet in which it shows of the steroid on it. And in certain situation you need to be increasing a dose of the steroid, and you should be taking steroid dose as prescribed by the doctors. Is that okay with you, Mrs. Hala?
Yes, doctor.
Okay, Mrs. Hala, we seem to be discuss many issues. Can you summarize for me, or you tell me what you understand from our discussion?
Yes, doctor, I knew that I have this disease, what's called Addison disease, because of deficiency of special protein in my blood called the cortisone, which is causing such these complications for me. And you are going to give me some medications in replacement of this steroid, and I have to take it all over my life. Thank you, doctor, for that.
Yes, okay, thank you.
Okay, finished? 13 minutes? Okay.
A minute?
13 minutes. Do you think that you convinced the patient to be enough to be compliant, and how important to be compliant on his medications?
Yes, I think so. Because steroid in her situations, she should be taking the steroid in the regular and as prescribed by the doctor, because to not going for Addisonian crisis.
Yeah, did you explain for her the complications of Addison disease, including Addisonian crisis or even loss of consciousness?
No.
Okay, so what do you think the ethical issues here?
Ethical issue? Okay, patient respecting the patient autonomy. The patient has right to know everything about the disease. The beneficial also. The beneficial of taking the and also non-beneficial to not harming the patient.
Okay, thank you, doctor.
Yes, thank you.
Thank you, Dr. Asana. Okay, open discussion about the case. Anyone has any comment?
Thank you.
Sadek, hello.
Yes, Dr. Mushabir, yeah.
Yes, regarding the thing, your concern was that whether it will be complicated or if there is going to any side effect due to the steroid.
Yeah.
But doctor told could be less side effect, and but this is not. There is no side effect. She should convince the patient as actually the hormone is not producing at all. So this is what we are giving. This is replacement therapy. So there is no chance of any side effect.
Yes, I agree with you completely.
Yeah.
So regarding the side effects of cortisone, you will not have this side effects of complications of cortisone, because the treatment you are given is just a replacement and neutralize the internal dose of cortisone in your body. So no complications at all or side effects of the long run cortisone. Okay. Any other comment?
Regarding to take this steroid, when we want to you should be aware of the complication of this sudden stop of this steroid. Also, when you have any stressful condition, any surgery or any infection, you should increase your dose accordingly, modify it.
Dr. Sana, she informed the patient about special circumstances like infection and recurrent vomiting, recurrent loose motions. At that time, she has to seek medical care and inform her gland doctor to increase the dose of steroid in this situation?
And to take injection of hydrocortisone with high in heart pocket. In such cases, feel any vomiting, any feeling sick or being sick, to take this injection before to go into the hospital.
Yes, she has to wear alert bracelet in her wrist and a bit of cortisone for any circumstances that she has a problem. It can be given at once. Dr. Sana, she informed the patient about the medic alert bracelet, but in the last or in the end of the discussion, in the summary. But it can be given. It has to be given during explanation of the disease, actually. Okay, so when I'm going to my station, I write in my white paper like that. Explanation of Addison disease. What is Addison disease? Simply, without jargon. Explanation of complications of Addison disease. Treatment of Addison disease, focusing on adherence or complete compliance of medication. And then I write Addison in special circumstances. Then I write special advice for the patient to wear medic alert bracelet. Then I write summary like that. I write summary, checking understanding, concern, and help for the patient. So that when I'm going to my station, I'll not forget any of these points to cover in the exam. So check handles, identify the patient, confirm the patient identity, introduce yourself to the patient. You can ask excuse me, just to mute the mic. Just to mute the mic, please. Then to ask the patient, do you want anyone else to attend our discussion? Because this is considered to be breaking bad news or counseling for chronic illness. Then open question, how much do you know about your condition? Then ask about expectation. Do you have any expectation for your condition, like Dr. Sana asked? So then tell the patient that unfortunately your blood test has been released and it is not as we hope. It's revealed that you have a disease called Addison disease. Do you have any idea about this disease, Mrs. Hella? No, doctor. Okay. Do you want me to explain you more about this disease? Okay. Then explain the disease simply like Dr. Sana did already. She did very well actually regarding explaining the disease. It is a disease due to deficiency or of one special protein called cortisone, which is very, very important hormone in the body. This is affecting the glands above the both kidneys. This disease because of many causes, most probably because of disturbance of the defensive system, which is attacking the two glands above the kidneys and causing this deficiency of this hormone. And this hormone actually controlling many systems in the body. It can cause, you explained the disease already. So what's the complication of the disease? It can cause weight loss, tanning of the skin, disturbance of electrolytes in the body, and even it can cause what's called a Addisonian crisis, a severe hypotension, and even coma. So it is a serious condition, unfortunately. I'm sorry to tell you that, Mrs. Hella, but I have to be honest with you. This disease, if untreated, it will be a serious condition. Then to talk about the treatment. The treatment is available in the form of replacement therapy of this steroid, and they will refer you to a gland doctor who will give you this treatment. This treatment can be given orally in tablets, and you have to be completely adherent to this medication. If you are not adherent to these medications, you may expose to a lot of complications. One of them is shock or Addisonian crisis, or even death. So, then after that, talk about special circumstances. In special circumstances like recurrent vomiting or loose motions or infection, you have to inform your gland doctor to increase the dose of steroid for you, because the requirement of the body to steroids is more at that time. It is very important to wear what's called medic alert bracelet on your wrist to make the other to know about your condition, and also to carry one ampoule of steroid to be injected in you if you needed it in any time. This is the core of our station here. Then to ask about social history, and then asking social history, Dr. Sana, you asked about the job, but you have to ask here directly after that, how much the symptoms affect your job and usual daily activities. This question has to be asked, because it will be followed by, I'm sorry for that, I refer you to occupational health care, for example, if it affects her job, or social worker if it affects her usual daily activities. After asking about the social history, the patient job and how much the symptoms affect their job and usual daily activity, with whom the patient is living, financial support, smoking and alcohol history. Then to ask about, to do summary, check understanding, ask about the concern, and then to give help for the patient. That I'll give you some leaflets and websites about Addison disease to know more about it, and I'll give you my contact number to contact me at any time if you want. That's all about Addison. If anyone wants to add anything at all. يبقى again بس headlines كده for Addison. What's Addison? Okay.
دكتور صادق.
تفضل شنو معي.
When the patient asks about for how long can I take this steroid, I can reply for her that according to the causes, because some causes, if treated, the patient cannot take like tuberculosis like this. Yeah. Or I will tell her, because most probably due to an autoimmune disease, you should take the steroid for a long time or for your life.
Okay, it can be TB, but most probably it is autoimmune adrenalitis, which is causing Addison disease. And Addison itself is autoimmune. Adrenal deficiency, it can be caused by many things. One of them is Addison. ولكن Addison itself is autoimmune disease. But we can reply this in the gland doctor himself is the one to decide for how long to take this medication. But most probably, if it is because of the defect of your defensive system, you are going to take it for life, and to catch it, they stick from the middle in.
Okay.
Okay, Dr. Sadiq, about the complication of steroid, it will happen? It will not happen in this patient, yeah? Or it will be happened, I don't know.
Yes.
Why
it will not happen.
Why it will not happen? If the patient didn't take medication, of course...
Because as the professor said.
It can happen if the patient is not adherent to the medication. If she is not taking steroids, she can develop any complications of Addison. Again, the headlines of Addison before you are going to the station. What's Addison disease? Simply avoid jargon. Complications, all complications of Addison disease. Treatment of Addison disease and how much compliance is very important in her case. Treatment in special circumstances like recurrent vomiting, loose motions, and infection. Special advice for the patient in like medic alert Brussels on the wrist and to carry 1 ampoule of cortisone. Okay. Okay, ناخد next case with Dr. Ashraf. He's going to the exam. Dr. Yahya.
معلش اتفضل.
Because we make a deal with Dr. Yahya to present the case before you came, Dr. Ashraf.
خلاص ما فيش مشكلة دي.
So can you excuse him?
ماشي يا بيه ماشي. الدكتور يحيى ما شاء الله بنتعلم منه.
لا هو الدكتور يحيى شكله دروبت اصلا يعني، فبالتالي تعمل انت الحالة. اوكي
ماشي يا بيه.
Okay, Mr. Khalil is 42 years old. He has been complaining of visual disturbance for the last 2 years for your kind care. Station 5.
Yes.
You have 3 minutes to
Good morning, Miss.
على طول ولا to prepare the case?
على طول معلش.
Okay.
Good morning, Mr. Khalil.
Good morning, doctor.
I received a letter from your GP that you have visual disturbance. Can you tell me more about this, please?
Yes, doctor, I have this visual disturbance. My brother has this visual disturbance for the last 2 years, doctor.
Yes, yes. What is the meaning by visual disturbance?
Yes,
Are he seeing the things?
Yes, doctor.
Is it blend vision or double vision, or what is the meaning, please?
He has difficulty to seeing objects, doctor.
Both eyes or one eye only?
Both eyes, doctor.
Yes. Are he seeing the face of me, seeing the face of me complete, or some area is defect?
I'm not sure about that, doctor, but he has difficulty of seeing objects clearly.
Are he seeing double?
No double, doctor.
Are there any pain in the eyes?
No pain, doctor.
Our color vision is okay?
Yes, doctor, no problem in the color vision.
Yeah. It is started suddenly?
No, gradually, doctor.
Gradually. And progressive, Mr. Khalil?
Yes, doctor.
Yes. Can I examine him?
Yes, okay.
I will see visual acuity.
Visual acuity is okay.
Starting by visual.
Normal.
Okay. I will see the field of vision.
Yeah. There is a defect in the peripheral.
Normal.
Peripheral field is.
There
is defect.
Both sides or one side only?
Both sides, yes.
Yes, both sides. I will see the movement of the eye. For the complete movement of the eye, H-shaped test. And I will ask, request if I can see the fundus or not.
Yes, you can see the fundus. Of course, fundus is very important in this case.
Yeah. Is the fundus has any optic atrophy or babble edema or
No,
any diabetic changes?
there is hyperpigmented polycystic hues in the peripheral field of the retina.
Yeah, yes. Good, Mr. Khalil. To be sure. The optic disc is also gray or near to white color.
It's normal.
Atrophy?
No
No.
atrophy.
The vessels is attenuated and straight.
Yes.
Can I ask you some other question, Mr. Khalil?
Yes, doctor.
Are there also other family member has same visual disturbance?
Yes, doctor. My older brother has a problem in his vision as well.
Yes. He is blind now?
Yes, doctor. Completely blind.
Are you have any difficult hearing, Mr. Khalil?
معلش يا دكتور دكتور أشرف do you have علشان
لا الهيرنج
do you have not are you
لا ايوه قاعد احفظ فيها من امبارح عايز درس خصوصي انا يا دكتور صادق لوحدي
لا
بس من بدري بقى معلش
انت الجرامر بتاعتك كويسه بس مشكلتك يعني the problem is are you have لا يعني do you have عشان الاكزامنرز يعني ما يمسكوش حاجه زي كده. Do you have what, doctor?
Do you have a hearing problem?
He has some problem in his hearing, doctor. But he's still hearing, but he has some troubles also in his hearing. There is diminution of hearing, doctor.
Are there any water work problem?
No, doctor.
Are there any abnormal movement or weakness in his limbs?
No.
If there is time, I will examine the hearing, sensory and bone relay and test, and I will see any ataxia. What's your concern, Mr. Khalil?
Yes, doctor. My brother is going to be blind like my older brother, doctor.
Yes, sorry, Mr. Khalil. Your brother has a disease called Ritinitis pigmentosa, which is a chronic progressive disease, which affecting the back of the eyes, and it is proceed to blind after many years. Sorry for that. Sorry for this bad news. But we can refer him to eye doctor, and I will do some blood tests and the imaging for his brain and imaging for his tummy, and I will tell you about the result soon, Mr. Khalil. Are there any other concern?
Why imaging to his tummy, doctor?
Yes, Mr. Khalil, sorry for that. Sometimes this visual disturbance is associated with some water work problem. So we can do the image to see his water work and his kidneys.
Yes, doctor. There is no treatment available to prevent his blindness, doctor?
Sorry, Mr. Khalil, till now no treatment for this disease, but the medicine, the science is progressing, and maybe later on will be some solution for this disease.
Okay.
Are there any other concern?
No, thank you, doctor.
Thank you, Mr. Khalid.
Okay. Doctor, this I'm the examiner now. Is asking. Doctor, did you ask about what's his job?
Sorry for that.
He's
Yes,
a lorry driver, doctor.
Right.
Yeah, sorry. Now it is difficult to continue his job.
It's
We have
difficult,
to,
or it is, he will be
inform-
banned completely, doctor.
He will be banned, and he will inform DVLA and occupational physician to search for another job for him. It is difficult for Mr. Khalil. Yes.
Yes. What other causes of retinitis pigmentosa the patient has, doctor?
I know that Refsum disease, which is associated with ataxia and cardiomyopathy, and
Did you ask about
retinitis
cardiomyopathy
pigmentosa.
symptoms?
No, I forget also. Another syndrome, Usher syndrome, which is associated with deafness and retinitis pigmentosa. Third one, moon beetle syndrome, and it is not this like this patient is usually female with hypothyroidism and polydactyly and obesity. Other one sometimes Bartter syndrome and
What?
another one syndrome.
What? Which syndrome?
Maybe Bartter also Bartter
syndrome.
hypokalemia. Maybe associated with deafness and retinitis.
Okay.
Albert.
Beta lipoproteinemia.
أيوة بيتا لايبو.
Kerner-Sayre syndrome.
أيوة.
Okay, did you ask about night blindness? Night vision?
Important symptom is.
This is one which will solve the dilemma for you if you ask it early. What about night vision? He will tell you that night vision or the vision the night is more difficult, doctor, so that you can know it is a case of the retinitis pigmentosa without even examining the case. Okay. Social history. Did you ask about social history for the patient?
No, smoking is important. Alcohol.
All the social history, job, and who support with whom the patient is living, financial support, smoke and alcohol. Okay, what about okay. Thank you, Dr. Ashraf.
شكرا جزيلا.
Okay, any comments about the case? A case of retinitis pigmentosa.
أنا دكتور صالح إنه
I think Dr.
is
Dr. Wael?
Dr. Saleh, I think he should. Dr. Saleh, I think he should ask about any other associated syndromes. He should mostly cover all the other associated syndromes with retinitis pigmentosa.
Like what, Dr. Wael?
Like also there is Usher syndrome, Friedreich's ataxia.
ask about the symptoms.
Albert
also.
Dr. Sadek.
Yes, Dr.
About
Mubarak.
ataxia.
Yes, I think regarding this thing, actually we should start with deafness, because deafness will be associated with the Usher syndrome and Refsum syndrome and this other Mons, Lawrence, Gödel and others. Start with the deafness. If deafness, maybe can case shares all are associated with the deafness. After that, one by one, we can exclude. Like if the patient is having diarrhea or the malabsorption syndrome, we can exclude this lipoproteinemia. This is associated with this malabsorption syndrome. or
Okay.
we can ask about the unsteadiness. If it is unsteadiness, then it will be more, close like Kelsia syndrome and this Epsom disease and fatigue ataxia. After that, if we ask about the chest pain or shortness of breath having cardiomyopathic feature, so it will be the Kelsia. But later on, maybe the two will come together, and only the Epsom disease and this other one is this fatigue ataxia. So we can ask about any sign of postural, any dorsal column involvement of cerebral involvement. So we can exclude like this way. We can exclude like this way. What do you think?
Yes. So in the case of retinitis pigmentosa, you have to explore all the other syndromes associated with retinitis pigmentosa and symptoms of other syndromes. Okay, let us start from the beginning. Any visual disturbance case, we have a protocol for any case of eye problem or visual disturbance problem. It is a schema fixed for all the cases. Okay. First of all, if it is a case of visual disturbance or clearing of vision, you have to ask a frank or open question. What do you mean? What do you mean by visual disturbance? Is it double vision or loss of peripheral vision or difficulty with color vision or just blurring of vision? I think this question will inform you more about the case. For example, if it is loss of peripheral vision or side of the vision, it can give you either it may be retinitis pigmentosa or it may be optic atrophy. If it is a difficulty of color vision, I just please to mute the mics because there is a lot of echo. If it is a problem in color vision, so it will guide you that it is a case of optic atrophy. So we'll start. What do you mean by visual disturbance? Is it loss of your peripheral side of vision, or difficulty with color vision, or loss of parts of the vision like central or peripheral parts, or just blurring of vision? Blurring of vision, it may be was hypertensive or diabetic retinopathy. And then to start at onset, when this visual disturbance started exactly, did it start suddenly or gradually? Is it increasing, decreasing, or the same? You notice anything that increases visual disturbance? You notice anything that decreases visual disturbance? Then you have to ask about 7 items. And these 7 items actually brought from Dr. Ahmed Meher. One eye or both eyes. What about night vision, tunnel vision, color vision, double vision, painful eye movement, eyelid drop, any eye secretions or gritty sensation? Because they brought a case before as a case of eye problem, and it was a case of there was gritty sensation. It was a case of Sjogren actually. In the case of rheumatoid arthritis, they brought a patient with rheumatoid arthritis, and the patient was complaining of eye visual disturbance. So he wants you to explore or what is the problem with this patient or the eye complication of rheumatoid arthritis. In this case, it was a case of Sjogren, secondary Sjogren syndrome. يبقى في 7 questions to be asked for all patients with visual disturbance. One eye or both eyes, night vision, of course this will take you to retinitis pigmentosa. Tunnel vision also, it will lead you to retinitis pigmentosa. And if you want to confirm about retinitis pigmentosa, you can ask him, do you have difficulty of seeing the walls if you are looking straight forward, or seeing the both sides of the road when you are looking straight forward? Color vision, of course, this will lead you to optic atrophy. Double vision, painful eye movement, eyelid drop, eye secretions, anything related to the eye. associated symptoms like headache and acromegaly, because associated symptoms like headache, it can lead you to acromegaly or even to benign intracranial hypertension. In young female patient like that with visual disturbance, low female patient, especially a female patient, you have to expect middle-aged female patient obese. You have to expect she is coming with blurring of vision. You have to expect a case of benign intracranial hypertension. Okay, so if impaired night vision, so it is a case of retinitis pigmentosa.
And
okay?
temporal arteritis.
What?
And temporal arteritis also in headache.
Temporal arteritis.
I mean temporal arteritis.
It will not come in the exam, Dr. Mushaber, temporal arteritis. I think this is emergency, and I think it will not come in the exam at all. Okay. So, if impaired night vision, it means that it is retinitis pigmentosa. At that time, you have to guide your questions on the asking about symptoms or symptoms of associated symptoms or of associated syndromes of retinitis pigmentosa. We have Usher disease, Refsum disease, abetalipoproteinemia, Kearney-Sayre syndrome, Bradet-Biddle syndrome. For Usher, we have to ask about. For Usher, like Dr. Mushaber said, first of all, they have to ask about hearing. What about his hearing? And the family history of deafness and the similar condition. Okay, this is for Usher. For Refsum disease has a lot of symptoms actually. They have peripheral neuropathy, so we have to ask about pins and needles. They have skin changes or skin rash. They have cardiomyopathy, so you have to ask about chest pain, racing of heartbeat, shortness of breath, and leg swelling. They have also ataxia, so you have to ask about anesthetic gait. This is for Refsum. Then for abetalipoproteinemia, they have steatorrhea, so you have to ask about any loose motions. They have also spinocerebellar and the dorsal columns affection due to vitamin E deficiency, so anesthetic gait also, but you ask it anesthetic gait and Refsum, no need to ask it again. But the characteristic of abetalipoproteinemia is loose motions or steatorrhea. For Kearney-Sayre syndrome, they have AV conduction block, so they can have a slow heartbeat. So you can ask about heartbeats. You asked about it before, and they have also cerebellar ataxia, anesthetic gait. Bradet-Biddle syndrome, they have kidney affection, and they have polydactyly, and they have also short stature. So you have to ask about any kidney problem. What about your water work, amount, color? Is there any frozen urine? For that, you covered all the most of the cases or syndromes associated with retinitis pigmentosa. After that, you ask about social history. What's the patient's job and how much his symptoms affect his job and usual daily activities? And I'm sorry for that, I refer him to occupational health care if his job is affected, or a social worker if his social life is affected. Then to ask about with whom the patient is living, financial support, smoke and alcohol history. Examination like Dr. Ashraf did, only do eye examination, okay, for visual acuity, visual field, and eye movement, and then fundoscopy. For this patient, visual field will be peripheral visual field will be affected, and for fundoscopy, there will be bony hyperpigmented spicules in the peripheral areas or peripheral field of the retina. They may be associated also with optic atrophy. Some patient may be associated with optic atrophy, so that you have to see the optic disc clearly if the optic disc is affected or not, and then order the patient to look to the fundoscopy to see the macula, if there is any macular affection. Very important for this patient to be banned, that you refer him to most of the patient of fundoscopy. Actually, you have to refer them to DVLA team, because for this case he will be banned from driving, because driving is risk for him and for the others. Regarding the concern, he's going to be blind, doctor. I'm going to be blind, doctor. I'm sorry to tell you that it is a progressive disease, but we are going to refer you to a specialized doctor to give you the proper treatment to slow down the progression of the disease. Studies and researches are going on for this disease, and it may be promising in the future. Retinitis pigmentosa are very common case in the exam for station 5 in Egypt and all over the world. Okay, any comment for this case? Hello? Okay. أنا مش عارف. I bought my papers on the page many times before, my papers for station 5. I think no one is caring about these papers. These papers are very focused and very systemized for the case of station 5. Not to forget any question actually. But we can shift to the other case.
Okay.
Dr. Yahya?
Yes.
Okay, Dr. Amai, we apologize because Dr. Ashraf, he took the case because he's going to exam your case.
Okay, no problem.
So, but
No
I
problem.
promise you will do the next time, inshallah.
Inshallah, no problem.
Okay, Dr. Yahya, a case of history taking.
Okay.
Mr. Hussam is 42 years old. He has been complaining of tremors in both hands for the last 3 days. For your kind care.
Okay.
You have 2 minutes to put your differential diagnosis, or 3 minutes to put your differential diagnosis about tremors in both hands. Then to go to your station. فدكتور أشرف يعني أنت you are going to the exam after 2 to 3 days مش كده؟ دكتور أشرف. دكتور أشرف مش معانا. دكتور أشرف. طيب أنا يعني يعني كنت أديله advice before going to the exam. وصل 10. Dr. Yahya, when you are ready, just tell me.
Okay, I'm ready now.
نبتدي؟
Okay.
Yeah.
Hello, Mr. Hussain.
Hello, doctor.
Hello, I am Dr. Yahya, and I am here to discuss about your health problem. First of all, let me confirm here about the GB referral letter. You are Mr. Hussain, 43 years old, and you are here because of hand tremors. Is that true?
Yes, doctor.
Okay, could you please tell me more about it, about this hand tremors?
I have this tremors in both my hands, doctor, shaking of my hands for the last 3 days, doctor, which is irritating me so much.
I'm so sorry for that. Okay, could you please tell me exactly what do you mean by tremors? Okay, so it's only in your hands?
Yes, only my hands. I have shaking in both my hands, doctor.
Okay, and you told me it started 3 days ago, right?
Yes, doctor.
So it never happened before?
No, never, doctor.
Okay, and in these 3 days, it happened suddenly, all of a sudden?
No,
Or
gradually,
it's
doctor,
gradual
but it
and
is
progressive?
increasing with me.
I'm so sorry. So sorry for that. So it's all the time, in the 3 days, all the time, or it's on and off?
No, most of the time with me, doctor.
Oh, okay. And did you take any medicine for that? You sought any medical advice for that?
No, at all, doctor.
Okay. Could you please tell me when you feel it more? Do you feel it during rest or while you are making some actions like writing or eating?
All the time, doctor, during rest and during my activities, doctor.
Oh, okay. I'm so sorry for that. And is it same all the day? Do you feel it's more while in the morning or at the night? It's the same all the time.
Same all the time, doctor. But it's increasing more and more.
Okay. Okay, I see. And you told me it's in your hand. Is it progressing, increasing to maybe to your arm or to your feet, maybe your shoulder?
No, only my hands, doctor.
Okay, I'm so sorry for that. And could you tell me, please, how it affects your life, how it affects your job?
I'm feeling embarrassed, doctor, between my colleagues. You know, I'm an engineer and I have difficulty in doing my job, and also I feel embarrassing between my friends because of this hand shaking.
Okay, I'm so sorry for that. We will try to help you. Could you please let me ask you some questions? Do you have any problem before, like unusual headache? Headache lasts for a long time?
No headache, doctor.
Okay, is there any weakness, any numbness in your hands, anywhere in your body?
No.
Okay, have you ever had before any faint, any falls, anything like this?
No.
How about any visual problems or